Welcome to Grainger Insights. My name is Kym Orange, and today we're going to be talking about the role that the built environment plays with patient experience. I'm glad to be joined today by Lynn Kenney. So what are some of the biggest challenges that you feel healthcare is facing today based on your experiences between ASHI and the center?
So, I mean, for sure, everyone's biggest question right now is what is going to happen with healthcare regulation? You can't pick up a newspaper or put it on the news without hearing about the changes in the Affordable Care Act. And of course, that has huge implications for patient experience. So as we kind of wait to see where that all settles, I know that that's a challenge. I also know that helping the industry understand how to implement and just be aware of that people, process, place framework is a big challenge as well. But that's also a very empowering tool. So we really want to see interdisciplinary teams coming together to share their knowledge and to discuss the challenges and be able to really improve patient experience.
Can you please speak to the people, process, and place framework?
Sure. So if we take a look at the number one issue in the healthcare environment, based on the data on the CMS Hospital Compare website, the lowest scoring area is quiet at night, which is noise. And so one of the examples of how we can apply people, process, and place to noise is from a place perspective, there are lots of mitigation strategies. Some of them could be noise-absorbing materials that are used in the environment, so anything from flooring to ceiling tiles to acoustic wall panels, or artwork even now today has some sound-absorbing properties. Another example would be lighting. So so it's so important to think about the built environment elements, right? So the flooring or the ceiling tiles, lighting, adjustable lighting in the corridor can also have a significant impact on noise. So the facility or support person really has the ability to have this conversation and impact if they understand the way that it can improve HCAHPS scores. So if lighting is, if you're able to dim the lights at night, then the place is going to support quiet. The people need to understand the importance of the HCAHPS scores and how that impacts reimbursement. And so you do that through the process, which is the training. So that's an example of how you bring together people, process, and place as an interdisciplinary conversation to really address some of the top challenges and issues that hospitals are having with their HCAHPS survey results.
Now, you've mentioned HCAHPS a few times and reimbursement. Could you kind of spend a little more time on that topic and just explain to our viewers the importance of that to healthcare leaders?
You bet. Yeah, so HCAHPS is the survey tool that's been implemented by the Affordable Care Act. And it's basically reimbursement has changed from from volume to value, and the HCAHPS or the CAHPS survey. With hospitals right now, there is 2% of the hospital's reimbursement that's withheld by CMS, and the hospitals have an opportunity to earn that back based on their survey scores. The surveys are sent out to patients, and those scores are updated 4 times a year. And the only way that the hospital can earn back that revenue is by getting an always. So the way that the survey works is never, sometimes, and the top box score, which is always. And they only get credit if they get always scores. So it's really challenging. And so that's why this framework is so impactful, because everyone's striving for always. And that's a tough score to get, right? Can you keep the hospital environment quiet all the time and have your patients, fill out that top box score? So the other part of the reimbursement is based on continuous improvement. So even if you've achieved some level of improvement, the following year you have to show that you've improved a little bit more. So it's a really challenging formula for healthcare leaders, and that's why it's so important to have these tools.
So let's talk about lighting a little more in the context of perception and cleanliness, if you don't mind.
Sure. So, cleanliness is another one of those really challenging scores. And I have this really great story about lighting and cleanliness. There was one particular hospital that had older bathrooms, and their EVS team, they knew that the scores for these bathrooms were really low when it came to cleanliness, and the EVS team worked so diligently to try to get these things sparkling clean. And they would put little tent cards up saying, your bathroom was just clean, but they just looked dingy and old. Well, the hospital didn't have the money to renovate. So as part of another initiative, as part of a sustainability initiative, the hospital changed out the lighting in the bathrooms. And so we talked about earlier, changing out lighting gives you the ability to dim the lights, which is that reminder to be quiet at night. Well, in this instance, they changed out the lights in the bathroom because it was saving them money to go to LED lighting. But lo and behold, that brighter light, that softer light, suddenly made this older bathroom look brighter. And so their cleanliness scores went up. So you can imagine how happy the EVS team was to have those scores finally go up, because they knew that those bathrooms are clean, but it's what is the patient seeing? What is their perception? What is their experience? And so that lighting really made an impact on cleanliness.
And the importance of always, can we talk about that a little more? You mentioned it earlier, but the importance of always being scored. Why is that so important?
Well, because that's just the way that CMS scores those survey results. They will only, the way that the reimbursement model works is that the scoring has to be based on always scores. If it's sometimes, then it doesn't count. So the hospitals, and so everyone's on a level playing field when it comes to that. They know that they have to strive for always scores, but it can be challenging.
Where can patients and even healthcare professionals learn more about their own scores and how they're performing in some of these areas?
So the CMS Hospital Compare website is where this all began, but it's evolved now since the implementation of the Affordable Care Act in 2010. It's really evolved. It's part of social media. It's part of the Consumer Reports websites. So there are so many resources out there for consumers. It's become a very, consumer-driven marketplace. Healthcare has become very consumer-driven. So social media like Yelp and Facebook, folks are posting about their hospital experiences. But I always tell folks, no matter what role you're in, leadership, solution provider, or you're the facility director or the EVS director of the hospital, know your scores, check them regularly, and always make sure that you know what you're being compared against, both regionally and nationally, and that's what the CMS Compare website will do for you.
Any next steps that you would share with your peers in terms of what they can do to start implementing some of these ideas and thoughts?
Absolutely. The best thing to do is to make sure that you're having those interdisciplinary conversations, and to just make sure that you really look at the facility through the eyes of the patient. We have this really funny video that Ashley produced called the Gurney Cam video, and they're putting, the staff on a gurney and wheeling them through the facility, and all of a sudden the facility staff is seeing the stained ceiling tiles, or, it's just making sure that you have your eyes open, you're really looking at the facility the way that the patient is experiencing it. But what's really important is just to make sure that you go to that Hospital Compare website, know your scores, and understand that they are impacting reimbursement, so that, it's important to know that, because that's what the hospital leadership is having to deal with every day. And to some extent, facilities leadership is having to deal with that because it impacts their performance reviews. And the other really important thing to do is to understand that people, process, place framework, because looking at the complex variables and how they interrelate from the framework of people, process, and place is what helps everybody have that interdisciplinary conversation and really come up with innovative solutions.
Thanks a lot, Lynn. That's all the time that we have today. And thank you all for visiting and watching Grainger Insights. To learn more, please visit the Grainger Knowledge Center. You can find it at grainger.com/knowledge.